The Trump administration's Department of Homeland Security has issued a new proposed rule on the issue of public charge. It broadens the definition of public charge to include using an immigrant's use of public benefits or social programs as a factor that can be used against them when they try to change to a more permanent status. The first Trump administration had broadened the public charge definition, which was then narrowed by the Biden administration. And now we're back to a new proposed broader definition. And by the Trump administration's own admission, it could lead to worsened health and a worsened economy. It was back in March of 2021 that the Biden administration formally repealed the 2019 Trump administration public charge rule. That 2019 public charge rule had a much broader definition of public charge by considering cash and non-cash benefits like public assistance programs, Medicaid, SNAP, and certain health conditions as heavily weighed negative factors against an immigrant if they were to then change their status later. The Biden administration then published its final rule with a December 2022 effective date that narrowed back down that definition of public charge to be more consistent with what they said was the 1990 field guidance, while adding clarity to the definition, taking away those non-cash benefits like Medicaid, for example, and adding clarity to the immigration statuses that could be impacted to avoid, as the department at that time said, unnecessary burdens on applicants and to mitigate the possibility of widespread chilling effects of that 2019 rule. Now, this new rule in 2025, as proposed, rescinds the Biden rule, but it doesn't reinstate that first Trump administration rule. In fact, it's pretty vague. It says the guidance will come at a later date, but what they're intending is to give more power to individual immigration officers to make their own determinations of who they think would become a public charge. And by doing so, can evaluate things like Medicaid, SNAP, and other social program use, even considering community health center visits. The Department of Homeland Security said the policy could save nearly $90 billion over a decade as people unenroll from or skip out on public programs. And like we said, the Department of Homeland Security says the rule will result in worsened health, higher prevalence of communicable diseases, increased rates of uncompensated care for hospitals, and increased poverty and increased housing instability. On the economy side, they said providers participating in Medicaid, medical suppliers, grocery retailers and agricultural producers, and landlords could all feel the pinch. You could read more on that proposed rule. We link to it in the description below.